Spina bifida is a part of a group of birth defects called neural tube defects. The neural tube is the embryonic structure that eventually develops into the baby's brain and spinal cord and the tissues that enclose them. Normally, the neural tube forms early in the pregnancy and closes by the 28th day after conception. In babies with spina bifida, a portion of the neural tube fails to develop or close properly, causing defects in the spinal cord and in the bones of the backbone. Spina bifida occurs in various forms of severity. When treatment for spina bifida is necessary, it's done through surgery, although such treatment doesn't always completely resolve the problem. Spina bifida occurs in three forms, each varying in severity. The mildest form results in a small separation or gap in one or more of the bones, vertebrae, of the spine. Because the spinal nerves usually aren't involved, most children with this form of spina bifida have no signs or symptoms and experience no neurological problems. Next, in this rare form, the protective membranes around the spinal cord push out through the opening in the vertebrae. Because the spinal cord develops normally, these membranes can be removed by surgery with little or no damage to nerve pathways. Last and most severe form, and the form people usually mean when they use the term spina bifida, is when the baby's spinal canal remains open along several vertebrae in the lower or middle back. Because of this opening, both the membranes and the spinal cord protrude at birth, forming a sac on the baby's back. In some cases, skin covers the sac. Usually, however, tissues and nerves are exposed, making the baby prone to life-threatening infections. Neurological impairment is common, including muscle weakness, sometimes involving paralysis, bowel and bladder problems, seizures, especially if the child requires a shunt, orthopedic problems such as deformed feet, uneven hips, and a curved spine, scoliosis, and doctors aren't certain what causes spina bifida. As with many other problems, it appears to result from a combination of genetic and environmental risk factors, such as family history or neural tube defects and folic acid deficiency. As a teacher, be aware that students with severe spina bifida may have numerous absences due to medical appointments or treatments or fatigue. Develop a communication strategy between the home and school to stay informed about absences and to keep the student and family connected to classroom learning. Determine the student's particular pattern of strength and needs. Students with spina bifida are typically stronger in language skills, weaker in motor skills, weaker in attention, problem-solving, organization, sequencing, and memory. Provide the students with copies of notes and assignments. Provide the students with 2 copies of books, one for school and one for home. Provide adaptive tools and materials such as slant boards, adapted writing, paper and pencils, and specialized computer software. If weakness in the arms and hands makes writing difficult, provide the alternative ways for the student to demonstrate learning. Provide additional time for transitions between classes, particularly in a large school. A trolley may assist in transporting books, laptops, computers, or other heavy items from room to room, if this is necessary. In collaboration with the student and parents, discuss the appropriate level and types of physical activity for the student. Take necessary precautions and provide close supervision during physical activities, especially if the student has a shunt. As I was searching through the internet, I stumbled upon the Daryl Gwynn Foundation and discovered a very inspiring article. The story is about a young man named Levi Lamb who loves to fish and enjoys hunting excursions. He was a member of 4-H and Future Farmers of America. Levi raises hogs and steers for show and dreams of getting a driver's license after his 17th birthday. He's just your typical teenager, except that Levi was born with spina bifida and is paralyzed from the waist down. It was so nice to see an article that proves that students with all types of abilities can participate in